Ankylosing spondylitis is a condition in which the spine becomes inflamed. Inflammation affects the joints between the vertebrae, causing pain and stiffness, and goes on usually from a young adult age lifelong. So pain and stiffness is often accompanied by progressive reduction in movement or flexibility of the back. In fact, a minority of people with ankylosing spondylitis also have involvement of other tissues. They may have inflammation of other joints, often the knees or the hips. They may have inflammation episodically in the eyes, iritis or uveitis, but can also develop psoriasis, a flaky skin rash, or inflammatory bowel disease. There are no completely accurate figures for just how common this disease is, but it probably affects between 2 and 5 adults per 1,000. We calculate there are probably about 200,000 people in the UK with this disease. Anyone can be affected by ankylosing spondylitis, both men and women. In practice, it is most common in people aged between 18 and 30. It does occur later in life. More often, we detect it later in life in people who've probably had it for a long time and put up with it. When ankylosing spondylitis begins, the commonest symptom that people experience is pain and stiffness in the low back. The more people rest, the stiffer the back becomes. Spondylitis can affect the chest. If the thoracic spine is involved, the ribs may feel tight, and that produces a sense of tightness in the chest, discomfort on twisting or taking a deep breath. People often experience buttock pain, which may radiate down the back of the thigh, and sometimes people get discomfort in the neck as well. That often occurs later rather than earlier in the disease. In fact, because people may also have involvement of joints or sites outside the spine, it's not unusual for people to have pain at the heel, either under the heel or at the attachment of the Achilles tendon, swollen knees, which may be painful, of course, or even painful hips. There are a lot of treatments available for ankylosing spondylitis, though none of them cure it. Occasionally, the disease becomes quiescent and seems to settle down, but for most people, it goes on more or less lifelong. Most people need some sort of pain-killing drugs. There are, of course, the over-the-counter drugs, paracetamol, codeine, which are often helpful. Many need to take anti-inflammatory drugs, and there's a wide range of non-steroid anti-inflammatory drugs which are often helpful. If the disease is particularly severe, and in spite of these medicines, life is very difficult, there is a newer range of drugs called TNF blocker drugs, which are also widely used now. Generally speaking, this is the kind of thing that you need to discuss with a rheumatologist. The key to all of the treatment is physical activity. Some people need regular physiotherapy for that. Other people prefer to do sport or to exercise regularly themselves. Everyone, however, with this condition should stretch the spine every day and take up some form of regular physical activity. It's also important to maintain posture. Many people sit for long periods of time during the day, and there is a tendency for the spine to stiffen in a rather bent forward position. That can be prevented completely by taking care of posture. For the majority of people, life can be absolutely normal. There is a good range of treatments when necessary. Not everybody needs them. An active life is an important part of this. So somebody developing this condition now really should look forward to a normal length of life, and a life in which they can do normal activities and live fulfilling lives.
For more information, visit www.nhs.uk.